Good afternoon, everyone. My name is Jeff Bourgeois, President and CEO at San Juan Regional Medical Center. Members of the media, thank you for joining us today for this very important update on the COVID activity level in our community. I'm joined today by a number of community leaders, uh, and they will speak in turn in the order I introduce them. But first is Dr. David Greenberg, an emergency medicine physician at our hospital, as well as one of our incident commanders. Commissioner Terry Fortner from the San Juan County Commission, Suzanne Smith, Chief Nursing Officer at San Juan Regional Medical Center, Mayor Nate Duckett from the City of Farmington, from the City of Aztec, Mayor Pro Tem Rosalind Fry, and from the City of Bloomfield, George Duncan, the City Manager, and then also joining us today is Mike Mestis, the San Juan County Emergency Manager. He's available at the end of our comments for any questions in response to actions regarding specifically San Juan County. So thank you again for joining us. I just wanted to provide a brief update, and then I'll turn it over to Dr. Greenberg. Right now, COVID is spreading through our county at an extraordinarily high rate. Second highest rate of spread of all the counties in New Mexico at 112 cases per 100,000. And that creates a circumstance where our hospital is extraordinarily full. Our ICU was at 129% of capacity as of earlier today, and our non-ICU adult beds were at 107% of capacity. We submit information daily to a statewide COVID dashboard for the regional hub hospitals, and of the 7, all but 1 were at or above 100% ICU capacity, and all but 2 were at or above 100% of their non-ICU adult capacity. And so that creates a circumstance where we really have, again, extraordinarily high levels of patient care in our hospital, and often requires us to hold in our emergency department patients that have been admitted, but we do not yet have a bed for extraordinarily long lengths of time, and that creates extraordinary backups in our ability to care for other patients presenting to the emergency room for care. Dr. Greenberg, let me turn it over to you to talk about crisis standards of care and also the safety and effectiveness of the COVID-19 vaccinations.
Thanks very much. So I'm Brad Greenberg. I'm an emergency medicine physician and the medical director of emergency preparedness at San Juan Regional Medical Center. And before we get into crisis standards of care, I just wanted to mention that, the preparedness efforts here at San Juan Regional Medical Center have been long-lasting and long-lived since the very beginning, and before the pandemic. We've really been working to be creative and thoughtful about how our response would take shape. Some of the more concrete examples of that are an expansion of our ICU capacity from 14 to 23 beds, and considerable expansion of many more beds for intermediate or progressive care capacity. So there's lots of different examples throughout the organization about how we've tried to adapt, respond, and increase our capacity and capability. Nonetheless, we find ourselves currently in a situation which extends beyond our ability to continue routine operations. And thus, consistent with the state's declaration of crisis standards of care, our organization has declared crisis standards of care for our hospital. Now, I wanted to talk briefly about what crisis standards of care are, what they mean, what they don't mean. And then, of course, I'll say at the beginning and I'll say at the very end that I strongly agree and would advise folks to get vaccinated with any of the safe and available vaccines. So, crisis standards of care is defined as a substantial change in usual healthcare operations that we're able to deliver, usually as a consequence of some sort of catastrophic disaster. In this case, the catastrophic disaster for us is the COVID-19 pandemic. This is declared by the state. Every state does it a little bit differently, but this is a formal declaration by the state, and then the state looks to us to declare it for our organization. And it really enables certain legal and regulatory protections for those healthcare providers that are involved in the necessary tasks of allocating scarce resources and implementing different kinds of facility plans to make sure we're doing the greatest good for the greatest number. So what that means is that we adapt our spaces, our staff, our supplies to do the greatest good for the greatest number, given the circumstances and the resources that are available. And I think that encapsulates it in a nutshell. However, one thing that's really important to recognize is that this heralds really the beginning of a struggle. The struggle that we've really been participating in for over 20 months now, which is to get back to more normal operations, to get back to conventional footing. So that means that we're going to be participating in ongoing preparedness activities, things like substitution, adaptation, conservation, reuse, reallocation, all these different techniques and different elements to try to be creative, to try to get back on a more conventional footing. Now, we have the structures that are already in place to recognize that our organization is indeed in these difficult circumstances. We know that there is a significant burden of illness in the community, and we know that I have a very good sense of where we are with our ability to care for those COVID and non-COVID patients in our community as well. And we've taken many steps to try to avoid having to implement crisis standards of care altogether. Now, the goals for crisis standards of care are to rationally allocate scarce resources in a pre-planned and structured manner. Now, in no way is this going to be a chaotic or haphazard process. This is an organized and methodical stepwise approach to optimizing care for all. What that means is for COVID, for non-COVID patients. And this is to be done in a way which is evidence-based, legally sound, and consistent with ethical norms. And so this builds upon what we feel is our duty to plan and our preparedness activities. And with this, we're going to focus on safety for all of our employees, coworkers, and colleagues, as well as the safety of all of our patients. So the hospital, I think, I'd like everyone to understand, is still a safe place. There's plenty of personal protective equipment, plenty of support. And part of this planning, it's really important, is that we continue to make space for non-COVID interventions. So please, please do not delay care if you need it. We're doing our best to assure that we have the appropriate resources to care for you, especially in the setting of things like chest pain, stroke-like symptoms, or trauma. Do not delay care because it could result in significant consequences. So we understand there's COVID, there's non-COVID, and we're here to meet all those needs. Now, one thing that's also important about crisis standards of care is that this is not a switch that gets flipped. All the hospitals within New Mexico, our hospital as well, has been living in this preparedness space for some time. And we have developed processes, systems, and spaces within the facility to do our best to meet these needs. And so we've advised our staff to continue doing the things that they usually do to meet the needs of all of our patients and meet the needs of the community. And this really builds upon the considerable preparedness activities and the response activities that have been ongoing for some time. So the things that are likely to happen next are consistent with the state's order for crisis standards of care. We will begin to credential COVID-19 providers. That does afford some of these providers that are practicing outside their usual scope of practice with some degree of liability protection in the form of participation under the New Mexico Tort Claims Act. In addition, we're beginning to coalesce what are called triage boards, which are groups of physicians that help with resource allocation. Please understand that this is not happening now. We're getting in a position to do that if and when it becomes necessary. And that's to make sure that those resources reach those people that have the greatest likelihood of benefiting from them. What we are doing now is we have ongoing actions with our operational plans using considerable creativity and resourcing to try to do the best that we can with the resources we'd have at hand. Some resources I do want to highlight and express considerable gratitude for are to the New Mexico Department of Health for providing their staffing assistance through the Jogan Health staffing service. And we're seeing over 30 personnel joining us in starting yesterday and in the coming days to join us on the clinical floor. One other group I'd like to express considerable gratitude for as well is the United States Department of Health and Human Services. The National Disaster Medical System has deployed a DMAT team, a Disaster Medical Assistance Team, to San Juan Regional Medical Center. This team, Florida 3, has 32 personnel with 20 different medical professionals of different skills and training. And they're also going to be joining us to try and help mitigate the effects of the COVID-19 pandemic and make sure that our community and our region has the resources necessary to meet these important healthcare needs. So this is a dynamic situation. We will continue to struggle and work very hard to get out of crisis standards of care and back onto more conventional approaches. We will never accept crisis standards of care as a status quo. This is a recognition of where we're at. And we must, as an organization and as individuals, we will continue to adhere to commonly accepted ethical norms. But we do have to accept that there are resource challenges. We're going to get through this. Please understand that getting through this is really our way through this is going to be through the sum of our individual choices as individuals and as members of this community. And one of the most important things that can be done as a member of the community is get a COVID-19 vaccine. There are multiple safe, well-studied vaccines. There are multiple non-political, depoliticized places you can obtain information about these vaccines and understand the science. I implore each and every person in our community and across the state to get vaccinated, become informed about vaccination if they're uncertain about it, and then reconsider and please get a COVID-19 vaccine. And in addition, in our current situation, I also implore everyone to use COVID-safe practices. We thought that we were going to perhaps get through this pandemic with the advent of the vaccine, but we've learned that this virus itself is somewhat difficult to predict. And here we are again with what is likely to be our greatest surge ever. So please wear a mask, wash your hands, appropriately socially distance, and take care of yourselves, take care of each other, and take care of your community. Thank you, Jeff.
Thank you very much, Dr. Greenberg. Commissioner Fortner, let's turn it over to you, please.
Okay, thank you. Thank you, Jeff, and thank you, Dr. Greenberg, for all your hard work and everything that you just said. So as Jeff mentioned, I'm a county commissioner, but I'm also here as a nurse practitioner, having practiced in this community for 40 years. And so what I want people to understand, that we're talking to our community, to understand that the hospital is struggling to be equipped to provide the standard of care that our community has grown accustomed to due to the spread of COVID. The rate of COVID spread is alarming. Our hospital is having to make huge changes to how they care for patients. That means for all of us who may seek care. An illness, as we know, is never planned. Our community has 104 per 100,000 new cases. When we were under the red, yellow, green rule, the new case ratio was 8 per 100,000 new cases for the red level. So what does this mean? A health battle is being waged in our community, mentally, physically, and spiritually. I've cared for soldiers in our community that have returned for more. I know some who haven't returned. What I know is that any battle, you must be equipped for as the key to survival. In our community, how we stay healthy is through exercise, eating nutritiously, as well as taking medications for diabetes, asthma, all types of chronic illnesses. We have the tool for survival of this virus, and that's immunizations. We are asking our community, please equip yourselves with this vaccine as the virus rages through our community. Our survival depends on each other as our community members, especially for our elderly populations and our children and grandchildren. What each person decides directly impacts our neighbors. Our community has always stepped up during a crisis. I've seen that time and time again. We care for each other deeply. That's part of the fight right now. This is who we are. The reaction to a crisis is fear. There's been a lot of fear lately, a lot of worry. And what fear does, it creates flight, fight, or freeze for survival. Let's move together as a community. Please help. Safety in our hospital is top priority for the staff and patients. We support our hospital staff. This is a community-acquired virus that has led us to inspire each other through kindness. So my question would be, how can we as a community help reduce the suffering? So over the course, since we received this alert about what's going on at the hospital, I've received a plethora of information and from nurses throughout our community that I've known for so many years. And these are nurses that are pleading, say, to me to tell their story. And so I'll tell you one of them. I'm going to share with you just a couple because there's so many that I could go on and on about their stories. And one comes from Taffeta RN. She says the COVID crisis has affected the community greatly, which has caused a huge strain on our providers in the community. Patients are sick and requiring resources that are spread thin, not only in our community, but across the entire state. Families and loved ones cannot be with hospitalized loved ones. Staff caring for the patients affected are working long hours and are exhausted. From a personal perspective, I have lost family and friends to this devastating crisis before the vaccine was available. Now the vaccine is available, we can slow the spread. Please help us. We are emotionally and physically exhausted. Get vaccinated, wear a mask, and wash your hands. That was Taffeta RN. And from one other that I'm going to share is from Jonathan RN. As an acute care nurse in healthcare in San Juan County, we are nearing the brink of systemic failure. COVID has stretched us incredibly thin at all levels. Healthcare workers are leaving their jobs, making the situation even worse. The only solution is the ubiquitous vaccine, especially among those at high risk. We are also doing everything we can to help our Native American population that has been decimated by this pandemic. We urge everyone to get the vaccine, but to also make lifestyle changes to improve their overall health, thereby decreasing their risk of dying and death. So I see such things as a nightmare, exhaustion, at the brink of they don't know what to do anymore. It has been a tremendous burden to them and their families. So again, I just want to encourage anyone that's listening to this, please consider the vaccination, continue to wash your hands and wear a mask. And I appreciate your time. Thank you.
Thank you very much, Commissioner Fortner. Suzanne Smith, an update from your perspective, please.
Thank you. Good afternoon, everyone. My name is Suzanne Smith. I apologize for my technical inability to be on camera, but I would like to implore our entire community to help reduce the strain on our healthcare system and on our caregivers. Please take the steps to avoid preventable hospitalization. It's critical that everybody return to their previous COVID-safe practices, including disciplined hand washing, social distancing, and mask wearing. As we merge fall into winter, colder weather means more indoor time and less outside activities. Be cognizant of those outside of your close personal contacts with whom you gather. Distance 6 feet or more, wear a mask when not eating or drinking, and be very cautious about your hand washing. If you have upper respiratory symptoms, such as a sore throat, a cough, or a fever, stay home. Monitor your symptoms and get tested. The best way to prevent contracting the disease, preventing hospitalization, being admitted to the ICU, or even ultimately death is to prevent it in the first place. And the best way to prevent is by getting your vaccine. So I would ask the cooperation, if you will, of our communities to support each other and to seek a vaccine. And in the interim, practice safe COVID, disciplined COVID practices. Thank you, Jeff.
Thank you, Suzanne. Next, let's go to Mayor Nate Duckett from the City of Farmington.
Thank you, Mr. Bourgeois. I appreciate the opportunity to be a part of this press conference today. I think first and foremost, just let me extend my appreciation to you and your staff for the continued hard work and providing as excellent care as we can possibly provide. I think from the community's perspective, from the mayor's perspective, it's important that we encourage our community to remain apprised of the situation that's happening here locally. Understand what's taking shape at the hospital, understand what's taking shape in our schools, and kind of adjust your personal activities, the things that you're doing based upon your risk of potentially getting COVID, having some negative effects because of that, which will differ from person to person. But generally speaking, our job here today is to communicate to you effectively the need for us to raise our awareness, to understand why this crisis of standards of care is being implemented at our local hospital, ways that we can adapt in this moment to ensure that we remain out of the hospital, because even if you're suffering from something other than COVID, that crisis standard of care applies to you. And so if you're there for a heart attack, a car crash, a stroke, it's imperative that you understand exactly what's going on and make those necessary adjustments where you can. As somebody who has received the vaccine, I am still a big believer that individuals need to seek personal medical advice. And I appreciate Dr. Greenberg reiterating the vaccine has been shown through data to be one of the best ways to stay out of the hospital if you do receive COVID. It reduces the effects of the COVID Delta variant for the most part, at least based on data that's been made available to us. I think those are important things to take into consideration. Certainly wearing a mask and social distancing are important, and they're important ways for us to not spread any virus. But as we have noted early on in this, COVID's going to be with us for a while. How are we going to change the ways that we behave in order to ensure that those around us, maybe we're healthy people, but I've seen healthy people get sick and be hospitalized. And as the husband of a nurse at San Juan Regional Medical Center, I can tell you the stories and the heartbreak from a personal perspective of seeing individuals who are my age that are reported to me, people my age who are having difficulty breathing. That's not a situation that I want to see anybody in. I think it's something we need to seriously take into consideration when we address this and understand that there are people who are being hurt. So make sure we understand what's going on, understand what the crisis standards of care is, do your part in our community to protect yourself and protect those people around you, and make sure you're aware. So final thing I'll just put on here, Jeff, is just a note. The city of Farmington at this point, the number of COVID positive patients within our ranks is the second highest that it's been since the pandemic began. We are maintaining services to the best of our ability. There will be some places that you will find where service levels have reduced. That is because we are adapting to this world that we're living in now, where we see a lot of people not in the workplace and also dealing with individuals who've been quarantined due to COVID. So be patient with us as we continue to find ways to provide that high level of service that I know this community has come to expect. Thank you.
Thank you, Mayor Duckett. Next, let's go to Rosalind Fry, Mayor Pro Tem at City of Aztec.
Thank you. I appreciate being here with everyone. I certainly appreciate the information from Dr. Greenberg and to find out, what the hospital is doing about these concerns. I've been hopeful that the emergency alert that went out yesterday was an eye-opener for the community. And with our discouraging statistics and low numbers of vaccinated and the number of sick and hospitalized, it seems like this should absolutely encourage countywide citizens to respond. And of course, I'm particularly interested in the Aztec citizenry. And we've seen a reluctance in our own community of citizens to wear masks and to feel safe in groups of people and so forth, which I'm sure has only added to the critical numbers that the hospital is seeing. And that just makes it very difficult. I encourage everyone to please wear your mask and protect yourself and one another. We just have to get used to this for a while where it's not over. And I think people have just become very, very tired of the whole process and want it to all be okay. We've had our senior center closed for throughout this time and only opened this week for 1 hour per day so that seniors can have lunch there in the Aztec Senior Center. We remain concerned about the vulnerability of our seniors in our community. As there have been cases among city employees, it creates the need for quarantine, which taxes the remaining employees to do double duty. And about 10% of our employees have been infected with COVID. So, and we've seen 4 spikes in infections in the last 3 months. We partnered with Care Drug for booster clinics and previously for vaccination clinics, and we will continue to support all efforts to make in the Aztec community to get people vaccinated and to encourage that. We have signs at the roads coming and going from Aztec to warn people traveling of the increased infections in our county, and that they can find more information available online. The city manager of Aztec and the chief of police have been working with the county to do our part and to keep informed about what is going on with COVID throughout the area. We are following the governor's directions in order to remain safe and not spread the virus. And I just reiterate this advice that has been provided by each one of you speaking is please get vaccinated, wear your mask, limit group activities, stay healthy, and we'll get through this. Thank you.
Thank you, Rosalind. Let's move to George Duncan, City Manager at Bloomfield. Can hear you, George. George, I cannot hear you.
I'm the city manager with the city of Bloomfield. We have and continue to provide information to our employees to properly social distance, wear a mask, and practice good hygiene procedures. I have been vaccinated, and I urge our employees to do so. And I also urge all of the public to get good information and make smart choices in regard to the vaccine. The city of Bloomfield lost 1 employee to COVID. It devastated our small community. Tragically, this was an impetus for many of our other employees to vaccinate. We believe we have around a 65% vaccination rate within the city. I would also urge, I have a background, in fire and EMS, and I urge our citizens to make smart choices and reduce risk. Do things that will limit your exposure to injury and help our healthcare workers. I would also say don't delay any healthcare issue you may have, but just make smart choices. We have and we will continue to make informational links regarding COVID to the public through social media and a LED message board here at the city of Bloomfield. We have also partnered to make clinics available to the community, and we will continue to do that as we go forward. Cases within the city of Bloomfield stand at 14, including that 1 death. Thank you for this opportunity to address public and our other partners, and we will stand ready to do what is necessary going forward throughout the county and the state of New Mexico. Thank you.
Thank you, George. Let me just wrap up, and then we'll turn it over to questions, and Roberta in order to help us with that. The time frame from October 1st through November 1st, so really the most recent month, we had 289 COVID hospitalizations at San Juan Regional Medical Center. Of those 289, 234 of them were in patients that were not fully vaccinated. That's 81%. Additionally, of the 43 patients that were admitted to the ICU, 39 or 91% were those that were not fully vaccinated. Of the 23 patients that required ventilator support, 21, or again, 91% of those were not fully vaccinated. And most importantly, of the 17 mortalities that we had due to COVID-19 in the month of October 1 through November 1, of those 17 deaths, 16 were among patients that were not fully vaccinated, 94%. Those are sobering statistics and hopefully speak to the ability of the vaccine to prevent hospitalization. But if you do get hospitalized, the ability to help you have a less severe course of illness, prevent ICU admission, prevent intubation and ventilator support, and ultimately greatly reduce your chance of death. So thanks again for all our panelists in participating today. So let's turn it open for questions, please.
Okay, I see a question. This is by Angela Salcido, KOAT 7. Is there any expected timeline for how long San Juan Regional will stay in crisis standards of care?
Dr. Greenberg?
So, good question. The best answer is the shortest possible time frame we can manage. Like I said before, this is an ongoing struggle to try and get out of crisis standards of care. The governor's declaration, I believe, extended to November the 17th. But we actually do ongoing analysis and try to make sure that our posture matches what the local demand is and what the resources the hospital is able to bring to bear. So I don't have a discrete timeline for you, but I can say that we have an ongoing, necessary struggle to get back onto conventional footing, and we'll reanalyze on an ongoing basis.
Thank you, Dr. Greenberg. I would also add that our test positivity rate at the hospital for the most recent 7 days is at 23%, and that has continued to grow over the past week. And so we do not feel we've reached the peak of this surge. We, as Dr. Greenberg mentioned earlier, feel that this will be the heaviest COVID surge of the pandemic for our hospital so far. So we have a little bit of a hill to climb yet. We just don't know how much.
Okay, and another question from Diana Castillo. When it comes to access to healthcare services to the community, will anyone be turned away if their medical issue is not deemed urgent?
So we have a requirement to complete a medical screening exam on every patient that presents to our emergency department. If they need care, we will not turn them away. Our concern is how quickly we can get to their healthcare needs.
I could build upon that a little bit. I think that part of our preparedness activities do consider making sure that we have space for acute illness and injury. Also, those folks that have a medical issue or a surgical issue that requires there's a time-dependent nature to it, we do our best to try and meet those needs as well. So I think that it will depend on the nature of the complaint, and then we will, of course, do our best to try to meet those needs as soon as possible. I think that the key message, though, is no one's going to be turned away, and we will do our best to meet those needs as expeditiously as possible.
Thank you, Dr. Greenberg.
Okay, additional question from the Durango Herald, Aiden Hanlon. Are patients currently being transferred out of San Juan Regional Medical Center to other hospitals in the region? Are patients being transferred to San Juan Regional for care?
Dr. Greenberg, I'll let you take that one as well.
Sure, I can address that. So, one of the reasons that we are actually, I would say, forced into declaring crisis standards of care is the inability to transfer patients, not just within the state or within the region, but within the larger region. We are not able to transfer patients to places as far as pretty far into Arizona. We've tried Las Vegas, Nevada, Salt Lake City, Denver, every hospital, especially hub hospitals within New Mexico and portions of Texas. So every day we actually do an assessment of whether or not we can actually transfer patients to other locations in order to meet their needs and also to reduce some of the burden on what's happening within our facility, especially as we have more than a dozen folks in our emergency department routinely waiting for beds. So we do attempt to transfer. It's very day by day, really hour by hour. The status within the state and the region changes. Occasionally, we're able to transfer a patient, and occasionally, we're actually able to fulfill our role as a regional healthcare center and accept a patient. But it's become very challenging to do so. Really, transferring a patient or being able to accept a patient has become more of a rare event.
Thank you.
I have a question that was emailed to me from Joshua Kellogg at the Daily Times. He had asked if the hospital is deploying additional COVID-19 beds or COVID-19 ICU beds.
Suzanne, you want to speak to how we've allocated our inpatient beds?
Yes, thank you. So yes, we have increased our capacity for COVID positive patients, both in the critical care environment and also in the medical surgical environment, also in the step down environment. So we have expanded our ICU beds from our historical 14 beds to 23 beds. 14 of those beds are dedicated to the COVID positive patient, and the remaining 9 are dedicated to the non-COVID patient. We have also had an occasional ICU level patient in our PCU or our progressive care environment because of the capacity in that 14-bed ICU. We increased our capacity on our med-surg environment by double occupying a small number of rooms in that COVID care arena that are capable of being double occupied. That is actually a total of 9 beds. And we have utilized that both last winter and again already this fall. We are also modifying the 5th floor, which is dedicated currently to PCU, progressive care patients, and cardiology patients, and we will be adapting that to accommodate the intermediate level or progressive care level of patient that is COVID positive as we see our numbers increase, our census increase. Thank you.
Thank you, Suzanne.
Okay, an additional question, Anna Buffington asking, there are still those that feel that the numbers of COVID cases put out by the state are inflated. How is it that we can overcome these myths? Any suggestions?
I guess there's the state has nothing to gain by doing anything but being truthful with the data they report. They are just taking the reports from the various testing centers. Those are submitted on a daily basis and reporting the facts that are reported to them. So I believe those results to be absolutely factual, and there should be no reason to doubt them.
Okay, that's the totality of the questions that I have currently.
All right, well, let's maybe just pause for a moment, Roberta, to see if any others have any follow-up questions. Okay, none received, Roberta.
additional questions at this time.
Okay. Well, let me close again by thanking members of the media for taking their time to participate with us today. Thanks again to each and every one of our panelists. We appreciate what you do in your various communities and in your various roles to help support our community-wide battle against the COVID-19 virus. And again, one last appeal to anyone who has not yet sought a vaccination. Please seek out a vaccination. And if you have any reservations about the safety or effectiveness, please consult your healthcare provider. The vaccines have been proven safe and effective, and they are essentially our way out of this pandemic. If we had a higher rate of vaccination in our county, we would not have the extreme burden that has been placed on our hospital and, more importantly, our frontline caregivers. They have fought long and hard over the past 19 to 20 months. And if you don't do it for yourself, do it for them. They need a break.